Hi everybody, welcome back to my channel. Today I'm gonna speak about VBAC. What is VBAC? VBAC is a vaginal birth after C-section. In my case, it was like this. So if the first birth was C-section, it doesn't necessarily be the next one C-section. So you can think about this, but you may be very afraid, like I was. If you had a C-section and you think about the vaginal birth, this video is for you. You'll find here a lot of good information and encouragement to do this. And stay tuned, because in the end I will tell you my 5 tips for a VBAC. I'm Maria, professional ballerina, and I love to inform and empower women to find themselves, to feel good in their bodies, and to go through fears. VBAC is the vaginal birth after C-section. And you also may hear the acronym TOLAC, which is trial of labor after C-section, which means you are trying to go in a labor which ends with a vaginal birth, which is success. My story starts when we moved to Canada and I found out that I'm pregnant with my second child. We didn't know it would be a girl, but I wanted a girl. My husband, he was like, 50-50. But this was not the most important, of course. At 13 weeks, I did my first exam at the doctor, and she asked me, what do you want to do? Because my first birth was C-section. And obviously, I told her, I don't know, because I had the experience with the C-section. I don't know what will gonna be with the vaginal birth, if it will be a success. My baby is awake. This is Aria and she is almost 3 months old. Hi baby! So my doctor said that I am in a low risk group. What does it mean? It means that my C-section was just one, first of all, and it's in the horizontal position. Next one is a healthy weight and ideal age, which is less than 37 years. And the time between births is at least 18 months. And I am great with all these terms. My fear was the uterus rupture, which my doctor said that is 0.5% of happening, and it's very, very rare. Just in case we are going into the labor and it's going by itself and everything is fine. If we add some medications to induce the labor, this may end like a C-section because the risk is higher. What was my due date was the 9th of September, and this little girl came on the 8th of September. So what my doctor said, that we are waiting till the due date, and if she doesn't want to come, we wait 10 more days and then we may do a C-section, because if we are not in time, it's the biggest risk for the baby and for mama. I was very lucky to get my doctor, Stephanie, which I love her. If you see this video, Stephanie, I'm very grateful that you are my doctor. She was very kind, helpful. She explained me, and the most important thing, she didn't push me to do this choice. She only explained me what's going on, like you're young. She asked me one thing, how many kids do you want? And I told her maximum 3. Then she told me, if you say 5 or 6 kids, I would advise you to have a VBAC. If no, you have the right to have a C-section, it will be fine. The second and third, the C-section are good to go. I was very afraid, like what will gonna be, the pain and all this stuff. And each time I was like, yes, I'm gonna do a C-section. And I don't know, it came with the thought that all the women do this and I will not be able to do? No, I will be able and I will be strong to do this. That's why I encourage you to find out what do you really want, to listen to your body, and to be pressured to yourself. If you want a C-section, don't even think about VBAC. But if you think about VBAC and you think about why not, I can do this, let's try, I am healthy, I am strong, I have an active lifestyle, and why not? Yeah, baby, yeah, baby. So the birth starts in the evening. I was on chill and I felt some wet and I didn't understand what is this? Is it starting? What's going on? I don't really have contractions, no pain, or I had some Braxton Hicks, but there were no painful one. And my husband asked me, "Do you want to go to hospital right now?" And I'm like, "No, let's do a pizza, and I'm hungry." I'm gonna do a shower, and if it's really starting, we'll count the time. We'll timing them, yeah, and we'll see. No, it's not the beginning. So, but it was really the beginning, and the contractions about 3 a.m. started more and more, and I couldn't get to sleep. But I was so afraid because a lot of women, the second birth is much faster, and I was like, I don't want to give birth home. I want to be in the hospital. I want there because we live straight near the hospital, and it's really like 5 minutes to walk. And they said, yes, this is the labor, let's go to get your room and you can change. My husband get back to sleep, and I was like, go back, I'm fine, I can handle this, I can watch some series. So at the beginning I was alone, and my first girl was home, Mira. This one was in the belly. At 7 a.m. I had 3 centimeters, and what happened next? At 8 a.m. my doctor Stephanie was at the work. So I get birth with my doctor, which is the luckiest moment of my birth. And she is so positive. She came to me and she was like, "Oh, you're doing good. We're doing a VBAC. Wow, nice, good job." At 7 a.m. I was dilated 3 centimeters, and they put me some oxytocin. At 8 a.m. I was 3.5. It was so slowly, but it was so painful. I don't know how the women get birth without a epidural. I thought that I can handle the pain, but I don't know. You should be very strong, and I'm proud of you if you, mom, get birth without an epidural. Because at 9 a.m. I was like, I can't handle this. I want an epidural, please, please, please. At 10 a.m. I was with the epidural and I was lying in the bed. Oh my gosh, so good. And I got to sleep. This was so cool. In one moment, I thought it would be a C-section for sure in the end. The heartbeat started to get slower during the contraction. I was so afraid. And the nurse helped me to change the positions on one side, the other one. I don't know what was the problem with the cordon maybe, but the heart rate was lower, and after again good during the contraction. It was about 2 hours like this. Again, my doctor came to me and she was like, we are 6 centimeters, we are good to go, no C-section, everything will be fine. And I was like, okay, no problem. If my doctor said this, I'm good to go. 4 p.m. she came to me and she was like, let's check. She was like, oh, we are 10 centimeters. Let's wait 1 more hour so the baby can go more down slowly by his way. And the head to be in a good position. She changed my position into the left, so I was lying on the left side. At 5 p.m. she came to me and 2 nurses helped me because my husband was home with Mira. They were not present, but it's fine. Like I was good. And they helped me with the knees. And what they told me is to push during the contractions. So deep breath, it was like this. And push with your internal muscles, which I fortified during the pregnancy. You can see all my videos, me with the belly doing exercises. And this helped me to give birth in 3 minutes. In 3 minutes. So the doctor was not in the room, and the nurse said like, let's practice a little bit because it will be like longer, half hour or 10 or 15 minutes, I don't know. And I was starting to push with my internal muscles, and she was like, no, stop, because the baby is going out. I'm like, okay, no, I don't want to give birth. The doctor should come. And she's like, don't push. And I'm like, okay, I don't push. And the next contraction, the baby is going out. And she's like, no. And I'm like, I'm not pushing. The baby is going out. And the doctor came in 3 pushes. The baby was out. Oh my God, so pleasureful when they put the baby here, and she started to cry, and she even gave me the scissor to cut the popovin. I think you name it like this, I don't know in English, maybe correct me in the comments below. And I was so happy that I did the VBAC, and I'm so proud of myself, very, very proud of myself. And my doctor said like, you're good to go. I had some tears, but she was like, it's normal to be. And the most important thing was my lactation came right away, which was different from the first pregnancy, the first birth. Mira didn't eat like for 24 hours. And I gave her some formula to not cry. But she was so hungry and my milk was not coming. And I was stressed and it was painful. But now different. Because the first hour the baby is right here, skin to skin, which is the most important thing after the birth. One more moment I want to tell you is that 3 days later, I couldn't walk. What happened is maybe during the birth, her head was positioned more in the right hip. And at the beginning, I was fine. I was walking like little by little. And in 2 days, I couldn't literally stand up. My husband was working, Mira in kindergarten, I had the baby, and I didn't have any help because my mom came just 10 days later. It was so hard to get through, but I'm strong and you are strong. We're like this. Dear mamas, here are my top 5 tips for a successful VBAC. Find a supportive care provider. Fight your fear. Write a birth plan. Join a VBAC support community. keep educating yourself so you can be empowered to use these knowledges that you get on the different websites, platforms. I hope this video helped you to find the tools you're gonna use in your situation, in your birth plan, and in your future. All of you have the strong body to give birth and believe in yourself with how I did. And I'm very happy that I did that, and I encourage you to do this. Oh, baby. They're so cute. Bye.